Hi there, this is Respiratory OSCE for Joan Cawthorn, nurse practitioner student with Athabasca University. Hi there, my name is Joan Cawthorn. I'm a nurse practitioner student and I'll be performing a respiratory assessment on you today. Is that all right?
Yes.
Okay, good. So the first thing I'm going to do is I'm going to wash my hands and gather my equipment for this exam. I have my stethoscope, and as well I have a pen and a ruler for one of the tests that I have to do today. So one of the first things that I'm going to notice with my patient is his general appearance. So I'm going to be looking at his color. I note that his color is nice and pink. I don't see any cyanosis. Can I just have a look at your hands? I'm going to look at his hands and his nail beds. They're nice and pink. And I'm also looking for any clubbing in his fingernails, and I don't see any clubbing in his fingernails at all. Okay, just relax. Okay, the other thing that I'm noting is the rate and rhythm of his breathing. I notice that his breathing is nice and relaxed. The rate and rhythm is average. I'd also, at this point in time, do a set of vital signs, and then also note any accessory muscle use as well, particularly paying attention to the supraclavicular area as well as the intercostal spaces, looking for any indrawing as well. I'm going to be looking the symmetry of the chest, both anteriorly, laterally, as well as posteriorly throughout this whole assessment. I'm noting any asymmetry and not knowing any lumps or bumps or flail chest, barrel chest, or any abnormalities in terms of his chest wall. Okay. The other thing that I'm going to look at is the anterior posterior diameter in relation to the lateral diameter, and I note that the lateral diameter is 1 to 2, which is within normal parameters as well. Okay, so the next thing that I'm going to be doing is I'm going to be feeling your chest, both the front and the back, so anterior and posterior as well as laterally. I want you to let me know if you have any tenderness. What I'm looking for is any tenderness and any subcutaneous emphysema. If it kind of feels like popcorn underneath the skin. I'm looking for any bruising, any lesions, and I'm not seeing any. And again, no tenderness when I'm going through here. And the same thing on the back. Okay, good. The next thing I'm going to do is I'm going to look for chest expansion, and what I'm looking for is symmetrical movement. So I'm going to get down in front of you here. I'm going to go into the costochondral angle and place my fingers here. I'm going to get you to take a nice big breath in. Good. And out. Good. And I see good symmetrical movement in the front. I'm going to just turn you around to the back. And then I'm going to go into the costovertebral angle in the back. And I'll get you to take a nice big breath in again. Great. And just let go. Perfect. And I see a 1 to 2 centimeter expansion, and that is also symmetrical as well. The next thing I'm going to be testing for is tactile fremitus, and this is looking for any consolidation. So when I lay my hands on you, I'm going to get you to say the word 99, okay?
99, 99, 99, 99, 99, 99, 99, 99.
Good. I'm going to do the same thing in the front.
99, 99, 99, 99, 99, 99, 99.
Good. And when I'm performing that test, I'm looking for any increases or decreases in fremitus, and certainly any absences in the fremitus, because any increases or absences or that would indicate a consolidation or an abnormality. And I didn't have any changes in fremitus, both anteriorly and posteriorly. Okay. The next thing I'm going to do is I'm going to percuss your chest. So I'm going to be using my middle finger and just tapping on it. And I'm looking at the changes in terms of the resonant notes, okay? I anticipate that there would be resonant notes throughout the lung fields with dullness over top of any fluid or organ such as the heart or the liver, and any flat sounds over top of bone. Okay. We're going to start out with the apices, which is the top of the lung fields. Just breathe normally. Oh. And certainly I heard resonant sounds with some dull sounds over top of the heart and also the liver. So I'm going to do the exact same thing on the back. Just turn you around here. And again, starting out with the apices of the lungs. Okay. And again, I heard resonant sounds throughout all the lung fields. Okay, good. Sorry, I should have not turned you yet because I need to do the test called diaphragmatic excursion and the posterior aspect of your back. So what this test does is it provides us with an indication in terms of how much your lungs expand, okay? So when I tell you to do so, I'm going to get you to take a nice big breath and then push it all the way out and hold it, okay? And after you hold it, I'm going to be percussing your back, just finding the lower edge of your lung fields, okay? All right. If you can take a big breath in and out and hold it, please. Okay. Breathe normal. All right. And the next, I'm going to get you to take a nice big breath in and hold it. Okay. 3, 2, 1. Big breath in. That's it. Okay. And breathe normal. All right. And then I'm just going to take my ruler and measure the difference between those, and it's 5 centimeters, which is within normal parameters of 3 to 5 centimeters. And in a clinical situation, I would be doing the diaphragmatic excursion on both sides in order to compare both sides. Okay, So the next thing I'm going to be doing is listening to your chest, okay? So since you're facing this way, you'll stay facing this way. And each time that I put my stethoscope onto your chest, I need you to take a big breath in and out through your mouth, okay? All right. Big breath in and out. Great. Thank you very much. You can breathe normally. So when I listen to your chest, don't turn yet. When I listen to your chest, I hear vesicular breath sounds. I hear bronchovesicular breath sounds in between the scapula and vesicular breath sounds throughout all the lung fields. I hear good air entry throughout the lung fields, all the way to the bases of the lung fields. They're nice and clear, no adventitious sounds, no wheezes, rubs, or rails. Okay, I'm going to do the same thing with the front part of your chest too. Okay. Big breath in and out of your mouth. You're going to listen to your trachea. Good. Good. Thank you very much. You can breathe normally. So when I listen to his lungs, I hear tracheal breath sounds over top of his trachea, vesicular breath sounds up in the apices, bronchial breath sounds right above his bronchi, bronchovesicular in between the two breaths, and the vesicular breath sounds in the lower lung fields as well. He's got good air entry throughout and certainly clear all the way to the bases. Okay, so the next thing I'm going to do is do a voice transmission test called bronchophony. And remember when we were doing the tactile fremitus test, I had you say 99. Well, I'm going to get you to say 99 again, except this time I'm going to listen with my stethoscope, and I'm listening for any changes in that 99, any increase in intensity, and that will indicate any consolidation. Okay?
99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
Okay, and I'm going to do the exact same thing on the back. All right, again.
99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99,
Good, thank you very much. Okay, so in terms of in terms of the bronchophony and the voice transmission test, I didn't see any acute abnormalities throughout all of his lung fields, both anteriorly and posteriorly. Okay, and that concludes the respiratory assessment. Thank you very much.